Good evening and welcome to the webinar tonight. Tonight our topic is delivering wellness for your patients and your practice through nutraMetrix Custom Health Solutions. My name is Reed Prescott. I am the Sales and Field Development Manager for nutraMetrix for the United States, and it's a pleasure to have you with us this evening. If you have any questions, you'll want to go ahead and write them down. You can even put them in the question box on your screen, and we'll get to them at the end of the webinar tonight. What nutraMetrix provides is a complete suite of customized cutting-edge solutions that are exclusively for health professionals. We provide a wide variety of products and services that are designed to help serve patients and at the same time generate an additional income for the practice. And we also provide the relevant information for the ever-changing economy of healthcare. As a health professional, you've probably noticed a huge changing paradigm in the last few years, even in the last decade, of the economy of medicine. Health professionals have been reporting several factors that have been contributing to these economic challenges. Some of them are the rising costs of doing business, the rising costs of drugs, and in turn, shrinking insurance reimbursements, and of course, the ever-changing regulations and reforms that happen to the medical industry. Several of these challenges have been reported over the last few years in the mainstream media. And here it is from CNN Money from January 2012 with the headline of doctors going broke, that they're barely making payroll and they're skimping on their own pay simply so they can maintain their business and continue to see patients and continue to pay their staff. Here's Wall Street Journal from March of 2012 with the headline, Why America's Doctors Are Struggling to Make Ends Meet, that reimbursements are falling short of covering the cost of care. This is just an additional page from that same article. What you're looking at on the left is a ledger of revenue and expense, and the practice this particular practice generated $2.1 million in revenue, but after all the expenses were paid, that health professional only kept $29,000. Here's CNN Money from June of 2012. The headline, Doctors, We Could Go Out of Business. Here is something a little more recent from CNN Money 2013, Doctors Driven to Bankruptcy. Now, the good news is, here's not good news, but the good news is in the internal papers, we're seeing that health professionals are overcoming these challenges by adding ancillary programs to their existing practice. So that's what we're going to talk about. How can you, the health professional, overcome some of these financial pressures? Well, you can certainly see more patients, and you probably already are seeing more patients. You can work additional hours, and we are coming to our health professionals as patients working 2, sometimes 3 jobs because of the shift in our entire country's economics, having to work more jobs. So we need health professionals who are open more than the traditional 9 to 5 or 9 to 6 business hours. We need health professionals who are open on the evenings or open on the weekends. And certainly health professionals can open up additional practice locations to make ends meet. And everything that we have talked about requires additional time and additional overhead. So we are going to be talking about offering additional services within the 4 walls of your practice. Now, how do you, as a health professional, know if adding an ancillary program, a wellness program through nutraMetrix, is the right fit for your practice? Well, if you have patients asking you some of these kinds of questions, like, Doctor, what do you recommend to help me lose weight in a healthy and safe way? Or, Doctor, I know I should be taking a fill in the blank, multivitamin, calcium, vitamin D, omega-3. Which one do you recommend? Or, Doctor, what alternatives do I have to whatever course of treatment that might be recommended? Now, we already know that patients are sold on the idea of wellness. In fact, $22.1 are spent annually on wellness products and services. But the question comes is, what are patients buying? And more importantly, who is giving them their advice? Because when it comes down to it, not all products are created equal. And the average consumer doesn't know how to read a label. The average consumer doesn't know how to look for artificial dyes synthesized flavoring agents, preservatives, disintegrative agents. They don't know to look for things that shouldn't be in their in a wellness product like talc or starch or hydrogenated oil or chemical coatings. And to illustrate an example, I'm going to share with you two very popular over-the-counter store multivitamin brands. Here we're looking at the label for Centrum Women Under 50. And this is the other ingredients. The ingredients are in tiny, tiny print that these companies literally bank on the average consumer not knowing how to read. And everything that you're seeing here highlighted in yellow is an ingredient that should not be in a health product. You're looking at cancer-causing dyes, hydrogenated oil, and talc as a filler to bind it all together. And then when it gets to our children's vitamins, it doesn't get much better. You're looking at those same dyes, hydrogenated oil, and it gets a little worse when we are feeding our kids aspartame. Whose idea was it to put a neurotoxin into our kids' vitamins? So, we are here to answer some of those questions and to provide solutions to the health professional to provide to their patients. We're in the right place at the right time. In fact, we've been at the right place even before it was the right time. We're helping health professionals generate additional revenue for their practice while providing wellness-based products and services that your patients are already asking for. The mission of nutraMetrix is to provide a system for health professionals to create an ongoing income while providing patients and clients with a better way to achieve optimal health. And we do that through revolutionary technology, science-based nutritional interventions, and the power of people. We are changing the face of healthcare, one health professional and one patient at a time. What I'm sharing with you now is a chart of our profit growth for the last decade. Now, nutraMetrix is a 10-year-old division of a 22-year-old product brokerage company. And the reason why I'm sharing with you these numbers is because when you're looking to make a partnership with a company, you want to make sure that they have a good reputation, that they have great sales, that we're going to be here for the long haul. And we have continued growth because the products and services that we provide the results that your patients are looking for. And when patients get those results, they reorder. And whether the products are used specifically for something or they're used as a wellness maintenance protocol, patients order and reorder and they share with their friends and family. And that's how we have such amazing growth. Now, nutraMetrix is a product brokerage company. And what that means is that we are not the manufacturers. What that means is we source out the best manufacturers in the country and have them make our formulations. In some cases, it's a product or service that already exists and we just rebrand it for us. But in most of the cases, our science and medical teams are going to these manufacturers with specific formulations that are made for us. Now, we have some things that make us quite unique from every other wellness company out there. And because there are unique differentiators, they are also your unique differentiators. Some of those are isotonic capable nutrition. So what this is this is an entire line of nutraceuticals that comes in a powder form. So there are no binders and fillers. So already that makes it the most pure form of supplementation on the market, bar none. Now you mix a specific amount of this powder with a specific amount of water, and when you do, it turns it into an isotonic solution. You take this on an empty stomach, and it is designed to rapidly be delivered within 5 to 10 minutes to the small intestines. So for the health professional, it's the delivery system of these nutrients that gets to your patient's intestines, the site of absorption. And for the patients, they taste great and they're easy to take, and patients will feel results. And because these are powder form, we can create custom formulas that either match the identity of your practice or go one step further, and we can formulate, or you can formulate for your patients, specific, we call them cocktails, that match the specific needs of each of your patients, and we can drop ship it directly to them. So you, the health professional, don't have to carry an inventory for all your patients. Another one of our differentiators is our gene snip program. What makes the gene snip unique is it's a laser-like approach to using nutrition and wellness in healthcare. It's personalized results that provide you with a powerful tool to really understand what steps you can take to achieve optimal weight and wellness goals. One of my favorite programs that we have is our TLS weight loss solution. That stands for Transitions Lifestyle System. And what this is an education-based program. This is not a diet. It's a lifestyle education. And it combines all the tenets of what it actually takes to lose fat and have a healthy body that no other program that I have ever learned about before has ever been able to put together. And those 4 tenets are low glycemic impact eating, changing your behavior around food through journaling and food logging, changing your body composition through activity and exercise, and smart and targeted supplementation to support specific needs that certain individuals have when they are in need of losing weight. And then I shouldn't have said that the TLS was my favorite. This is actually my favorite differentiator. Every health professional has their own consultant or even team of consultants to help support your wellness vision. And what we do is we meet with you, assess your needs, what your patients are asking you about, what you want for your practice, and the kind of revenue that you would like to add to your practice. And with that information, we will put together a program that is specific to the needs of your practice. So how do you know if your practice is in need of wellness or if you are on the way to transition into wellness? If you get nothing from this webinar, take with you these 3 questions and implement them into your patient care. And after you're done with your course of treatment, ask your patients, are you happy with your current health? And then listen for the answer. 9 times out of 10, I'm certain most patients are not happy with their current health. And then ask them, if you keep doing what you're doing, will your health improve? And then listen for the answer. And then follow it up with, if you could support one area of your health, and that's specific, it's one area of your health, what would it be? And then listen for the answer. Now, sometimes that answer might come in the form of a referral to a specialist. It might come in the form of, if you're implementing nutraMetrix, a nutraMetrix product or service. Whatever it is, you've taken that extra bit of time with your patient, and even that extra bit of time is wellness care. And that's the kind of wellness programs that we implement with nutraMetrix. With your nutraMetrix account, you also get your own privately addressed or privately URL'd nutrametrix.com web portal. Now, this is a website that is semi-customizable. You can put your practice information right on the homepage. There are health blogs that are customizable. There are health assessments on the website, and education is really the primary purpose of the website. It is also connected to our warehouse 24/7. So your nutrametrix.com portal is open for business. It's e-commerce ready, even when the doors of your practice are not open for business. We also have a plethora of marketing materials that your consultant will meet with you to decide what is the right fit and which marketing materials are right for your practice. And how does it work? I actually just explained it. We meet with you. We assess what your needs are, put together a proposal based on those needs, simply for you, the health professional, to evaluate and see if it's a fit for your practice. If it's a fit, we go ahead and open the account, and we implement and teach and train you and your staff on how to simply and efficiently provide wellness services for your patients. So let's talk a little bit about money, okay? We're going to use a sample model of a health professional that has 5,000 patients. Depending where you are in the country, that's either a very large practice or a medium-sized practice. Now, we've run a survey in this practice that says 65% of patients want wellness alternatives. Now, I need to let you guys know, we've run surveys in practices for almost 10 years. And when asked, that number is actually higher than 65%. That number is actually between 85 and 95%. When asked, patients prefer or want wellness education or alternatives or products from their healthcare provider, from their medical professional. So we're going to underpromise tonight and hopefully overdeliver for you. And we're going to say 65% of this practice want wellness alternatives. Now, to have a successful implementation of this size, we only need to target 10% of the entire patient base. What does that mean? That means that only about 500 patients need to be on a wellness protocol. And again, this is a wellness protocol that patients have already said that they want to be on, and we have a system in place that has patients self-identify the kind of wellness care they want to receive. So if we take 500 patients, that's a large number still, and we break that down to it on a daily goal, that's adding 2 or 3 patients per day to a wellness protocol that they already said they want to be on. So let's turn that into money. Okay, so this is a custom formula that has 3 of the isotonic products in it, as a serving of multivitamin, a serving of activated B complex, and a serving of our calcium, all in isotonic form. The suggested retail is about $63. The wholesale cost is about $50. And if you had 500 patients ordering and reordering this product every month, again, they've already said this is what they want to be on, we can bring in about $6,400 to the practice every month. Now, if we look at a more comprehensive formula, this has the multi, the B, the calcium, also vitamin D3 with K2, and a very powerful and potent antioxidant called OPC3, which stands for oligomeric proanthocyanidins. This has a suggested retail cost of about $123. And if we had the same 500 patients ordering and reordering this on a monthly basis, we could bring in $14,000 to the practice every month. We also have a secondary income stream on a commission or an ancillary income stream, an associated revenue income stream. And this is based on moving volume. So if we have the same, here's that first formula. Remember, we had 500 patients ordering and reordering, bringing about $6,400 every month. Now, every product has a point value assigned to it, kind of like a frequent flyer mile. When those points reach certain benchmarks, you get paid the associated revenue on it. So this product is going to generate about 14,000 points every month. On an annual basis, these points translate to about $26,000. Now, I need to let you know, our commissions get paid on a weekly basis. This chart calculates it on an annual basis on that third line. But the total revenue that we can bring in every year to the practice is just a little over $100,000. And remember, your patients are already buying these products outside of your practice, and it's not an isotonic product, and it's not going to be a product of a quality that is worthy of your patients. Now, if we look at that more comprehensive formula, remember here is that formula that can bring in about $14,000 in every month in the retail profit stream. If we take a look at the points that it generates, about 32,000 points every month, which roughly translates to about 58,000 annually, the total revenue that we can bring in with this kind of a formula in your practice is about $235,000. So what are your next steps? Your next steps are simply to consult with your NC, your nutraMetrix consultant, and determine the best ways to customize these solutions to meet the needs of your patients and your practice. We'll customize any products and services that need to be adjusted along the way until it is the right fit for your practice. We'll open up your account just to let you know what that entails. It's $159.95. It includes that nutraMetrix web portal that is e-commerce ready and attached to our warehouse from day one. So any support materials, and it renews annually for $129.95. And the only recurring investment in your nutraMetrix account is a $20 back office. And that manages all those orders for you and all the commissions, the associated revenue as well. After that, we'll schedule a staff orientation and training to help them understand your wellness vision and to learn how to implement your wellness vision efficiently and successfully. We'll train any key members of the staff to help support the ongoing wellness vision and the revenue generating part of the program. And then we measure the ongoing progress and success and make any adjustments along the way so that we are always in line with whatever your wellness vision is for your practice. Now, I want to take a few moments and introduce you to Dr. Deedra Mason. Dr. Mason is a naturopath. She's also the Director of Clinical Education and Research for nutraMetrix and for the nutraMetrix Educational Institute. She is a great colleague of mine, and I'm going to take a few minutes and ask her some key questions about what were her deciding factors on why she decided to start implementing nutraMetrix products and services into our practice, or her practice. Dr. Mason, are you with us?
I'm with you. Thanks, Reed, for the invitation to be on the call tonight.
It's a pleasure to have you here. So how did you first learn about nutraMetrix?
Well, nutraMetrix wasn't a brand that I was familiar with. I'm being very familiar with a lot of what I've referred to in the past as the big six. nutraMetrix wasn't on that radar, and it's interesting to me because they have, and we have such a unique delivery system with isotonics. So a couple of things started with us with nutraMetrix. We had, at the time, a small integrative medical center in Portland, Oregon. And it was 5 women together to kind of put a better system together, a better program together, or a better facility or center together for our patients. And because of that, we were very much a small group and very much probably didn't have the kind of capital that you needed to be one of these large medical groups or compete with the Providence and the Kaisers. But we had heart, we had passion. And our nutraMetrix consultant was very savvy because our nutraMetrix consultant knew that her best laid plan would be to speak to the owner of the center rather than me. I was very much the mouthpiece. I was very much the marketer. I was the one that went out and did lectures for our center or brought people to the center to discuss the importance of integrative medicine. But she was the owner, and that meant she was the decision maker. So our nutraMetrix consultant was very savvy and sat down with Dr. Aber to discuss the benefits of nutraMetrix. When I met my nutraMetrix consultant, I really wasn't interested in what nutraMetrix had to offer. And it wasn't because I didn't recognize the brand. It was because I was really happy with what I was already doing. I was successful with my patients and the medicinal or the nutraceutical lines that we were carrying. We carried many and still do. And we always wanted just to offer what we knew would work for our patients and what was best. But at the end of the day, we were happy with what we were doing. And I didn't have time to work with her. What ended up happening, Reed, was as I was leaving, just a really something as simple as a meet and greet with her. She was meeting with the owner of the facility. She mentioned isotonic capable nutrition, and I do IV therapy. So this became kind of something that perked my ears up. I wanted to know more about a product that was isotonic capable because I had patients that weren't willing to have me stick a needle in their arm, and I had patients that were very had compliance or adherence issues when it came to taking botanicals or herbs or things that don't taste good. I had the same compliance or adherence issues when it came to the prescriptions that I wrote. Patients don't like the side effects of their pharmaceuticals, and for that reason, they're often not compliant in taking them unless there's something urgent going on or painful going on. And so I knew that I could do the same thing with this nutraceutical line that I was able to do with other nutraceutical lines, improve quality of life, improve energy, hopefully, for my patients, definitely maybe give them an alternative before I had to write them a prescription. But again, like I said, I was happy with what I was currently doing. So the thing that really set this product line apart for me was the fact that it was isotonic capable. It was a product that would maybe give me access to patients that wouldn't let me do IV, but I would still have an IV type of solution for them, or what at the time I referred to as my take-home IV cocktail. For them, they would come into the office for regular cocktails, and then I would send them home with my oral IV cocktails. And that worked brilliantly for us. And the reason, to be perfectly transparent about it, wasn't just the fact that our patients received results. It was the fact that the program itself was quite novel. The idea of isotonics and customizable formulas made me a very different kind of doc. You couldn't go somewhere else and get this formula. It was something I made for you. And so the novelty was something else that patients really gravitated towards. And we saw higher compliance after we started using isotonics in the practice.
That's great. I have another question for you, and it might be a two-parter. How has your life and or practice, that's the two-parter, how have they changed because of nutraMetrix?
Well, I mentioned that we were a small practice. We did not stay a small practice, and that was quite exciting for us. We had very large growth, which, again, I'm going to attribute to the business acumen of the owner of the practice, Dr. Aber, who was working day and night to build us into something amazing, and she succeeded. But nutraMetrix was right there helping us do that. Again, we had patients coming to see us, referring patients to us because of isotonics. We had patients being referred to us because we have this fantastic weight management program that was working. We had our staff was losing weight. The physicians that were in the practice were losing weight with our TLS program. We were teaching classes, and their friends and families were noticing. And so we started to build a referral base, again, have that kind of competitive edge when it came to other commercial weight management programs that had not been successful for them. Definitely gave us a competitive edge in offering something that the larger facilities or the larger medical groups were not offering, because quick weight loss, while it was very popular, had its dark side as well. And so we really, again, were able to speak to that patient that didn't just want an option for better health or optimal health, but to look better naked. And that ended up being our big hook at the Wellness Center. We ended up being able to successfully run several meetings for our weight management program, TLS Solutions, throughout the week with us as coaches and practitioners making these recommendations, seeing people lose weight, be able to get them into the practice. They came for yoga and weight management. What they ended up staying for was the fact that we have this very unique design for overall well-being, this kind of one-stop shop for what you could do for your health. And that manifested growth from 5 practitioners to 13 practitioners. So we know the nutraMetrix had a great deal to do with that growth. We really appreciate what nutraMetrix was able to do with that growth. I mentioned we had staff members losing weight and people asking about it. This is, I guess, in answer to this question, this is where I get to say I'm not just the owner of a successful business, I'm also a client. I successfully lost a significant amount of weight, significant for 5 feet 4 inches. 48 pounds is significant on my frame. And while I think that that's wonderful and I've been able to help patients do the same thing, I really do think the testament of the TLS system is the fact that 8 years later I have not put any of it back on.
Yeah.
And we were wildly successful with TLS. We continue to be wildly successful with other programs that nutraMetrix exposed us to. Again, customization being one of those things that made us a very unique practice People love the idea of customized health.
Great. And one last question. What piece of advice would you give to a health professional who's evaluating nutraMetrix to see if it's a fit for their practice?
I suppose, they say there's bad news and good news, and custom dictates that I give you the bad news first. It's not a program that runs on autopilot. It's not a program that is difficult to implement. By no stretch of the imagination is it difficult to implement, but you do have to be consistent. It does not run on autopilot. Your staff will not be able to do it without you. That doesn't mean that you're rolling up your sleeves and getting dirty. It does mean that you're opening up your mouth and telling your patients that you'd like them to get started on a multivitamin at the very least. That it's important for their health that they take an omega-3 fatty acid, and that it may be important for them to take more in the beginning and have a higher commitment to their health through supplementation in the beginning to overcome or offset some of their lifestyle choices. I do make sure that I tell my patients in a very dry manner that no amount of multivitamin can turn the clock back on 50 years of bad behavior. This will be, for many of us, a slower solution to their health. Nutraceuticals do not act like pharmaceuticals. And I think it's very important that your patients know that that nutraMetrix and other wellness-type programs like the TLS weight management solutions and the like are an adjunct to the medical care that you're currently offering or the primary focus of your discipline. And from there, really nutraMetrix are the types of things that they do to stay healthy in between office visits. And they can expect better results when they do those things in between office visits. There's no substitute for a multivitamin, an antioxidant, and an omega-3 fatty acid. These are things that the body absolutely requires for life. And some of us require more to offset our bad behavior or genetic factors, stress, lifestyle factors that may make us ill. It can be as simple as just reminding your patient about staying healthy in between office visits requires more commitment than maybe they've been giving themselves. That's really the tip I would give health professionals looking at nutraMetrix, is that you do have to make sure that your patients understand that this is a system of wellness that can help them reach their goals, quality of life, quantity of years. But we have to tell them that we believe in it and that we have a commitment to it ourselves. It's important that our patients know that this is part of treatment. This is part of the program, that it is not optional. And while results may vary, they can expect better results with higher commitment. And that includes higher commitment to supplementation and diet. And that's why I always put supplementation along with diet, because the two go hand in hand.
Right. So Dr. Mason, I want to thank you for being with us tonight. For the health professionals who are with us tonight or watching this as a recorded webinar, your next steps are just to get your questions answered. Have your consultant customize a program that's designed for your office needs and evaluate it and see if it's a fit for your practice. Thank you for taking the time for learning about nutraMetrix Custom Health Solutions, and we will see you on the next webinar.